So this is not a mistake. That elephant and the therapist are there again, but this time we've got recovery labeled across the elephant. So that's the new elephant. And here's my thoughts about what this slide reflects. My thought is that we have addiction, and the cornerstone of addictive disorders is we can't talk about it. The elephant, it's all there, but we can't talk about it, right? So then we get into recovery, or people get into recovery, and what we tell them is now you really shouldn't talk about each other's recovery programs. What you need to do is stay on your own side of the street, and yet, we've got these issues in our relationship, and we're not able to talk about them. We're not talking about what recovery means to me and how I can integrate it in my relationship. And so I think, and I don't think this is an overstatement for many people, I think we re-traumatize couples because what we're reinforcing is a pathologic system that says you cannot talk about what's in this house, whether it's addiction or recovery. You need to figure it out on your own. Now, what would happen if we were to take that elephant and say, you know what, the elephant actually is in this room with us, and let's talk about not only the impact of addiction, but let's talk about the impact of recovery and how you're feeling about where you're at as a recovering family or couple and what you need as a recovering family and couple, and to move through this process together, if possible. Now, the Gottmans I know talk about, as we all know, there's contraindications for couples therapy, and so there's always contraindications. The problem is that contraindication is a default in recovery, and it shouldn't be. I think the assumption should be, let's default to the notion is that there's a place for couple recovery, we need to assess for it. But let's not default to this notion that you shouldn't do it because you need a year of recovery first. Now, the thing I want to make clear is that this is for existing relationships. I'm not talking about starting a new relationship in the first year of recovery. I think it's really a bad idea for most people to do that. So I'm not talking about that. I'm talking about an established relationship, somebody gets into recovery, and now we need to talk about the impact. So what we need is a new paradigm. Couple recovery, it is time for us to move into this concept and have this paradigm shift. Now, when I gave a workshop on this very thing for couples in Seattle a couple of years ago, I met with staff who had sponsored this workshop for couples, a treatment program in Seattle, Edgewood, Seattle, it's called. And so I met with staff and I met with local professionals in the Seattle area a day before the workshop. So it's a 2-day workshop I created. And there was another family interventionist, not the same one I spoke about earlier. And so we're sitting around in a circle. I'm kind of going over what the workshop's about and how couple recovery could be helpful. And she started the little session by saying, so I have to tell you, I'm kind of a skeptic here. It's hard for me to see how couple recovery can be a part of early recovery, especially. I said, okay, well, let me give you my spiel and then see what you think afterwards. So I gave my spiel, and we had a couple hours. We were talking this thing over. At the end, I swear to God, she said this. She goes, now I get it. I wish I would have known what this workshop was about. I absolutely would have referred couples. So what I'm discovering is that even though there's an initial resistance, oftentimes, or kind of a suspicion, and that's understandable, once people understand how this could actually work, you go, why aren't we doing this? I can't tell you how many times I've heard that at workshops with couples or with professionals like yourselves. Why aren't we doing this? I don't know, let's change it so that we are doing this now. So all of us here, I know, have heard addiction is a family disease, right? And the problem is that we don't actually treat it like one. We treat it like an individual one. But that's what we can change. We can treat it like a family disease.
Hi, this is Dr. Navarra. I hope you found this video useful. If so, please hit the thumbs up button and pass the word. If you would like to receive the latest notifications of relationship tips, hit the subscribe button. Thanks.